Good afternoon. Welcome everyone again to this Number 10 press conference where I'm joined by Professor Chris Whiddy, Chief Medical Officer, and Sir Patrick Vallance, our Chief Scientific Advisor. And I'm sorry not to have been part of this trio for so long. I want to thank everybody who's been doing such a good job in my absence, and I want to thank the NHS for so much, including getting me back here, and I might add, for a much happier hospital visit yesterday. In a few minutes, I'm going to hand over to Patrick and to update you on the epidemic, but first I'm going to set out today's latest data. 901,905 tests for coronavirus have now been carried out in the UK, including 81,611 tests yesterday. 171,253 people have tested positive. That's an increase of 6,032 cases since yesterday. 15,043 people are currently in hospital with coronavirus, compared to 15,359 people yesterday. And sadly, of those tested positive for coronavirus across all settings, 26,711 have now died. That's an increase of 674 fatalities since yesterday across all settings. This figure, of course, includes deaths, not just in hospitals. Across this country, therefore, families every day are continuing to lose loved ones before their time. We grieve for them and with them. But as we grieve, we are strengthened in our resolve to defeat this virus, to get this whole country back to health, back on its feet. And we're determined, urgently and in particular, to overcome those challenges that in the last few weeks have been so knotty and so infuriating. I'm not going to minimize the logistical problems we have faced in getting the right protective gear to the right people at the right time, both in the NHS and in care homes, or the frustrations that we've experienced in expanding the numbers of tests. But what I can tell you is that everyone responsible for tackling these problems, whether in government or the NHS or Public Health England, local authorities, we are throwing everything at it, heart and soul, night and day, to get it right. And we will get it right, and we're making huge progress. And I will not underrate the work and the achievement of those who are dealing with global shortages in a global pandemic. They are rising to a challenge we have never seen in our lifetimes. And the same can be said of the entire people of this country, staying in enforced confinement, not seeing family, not seeing friends or grandchildren, worrying about their jobs and the future. And so my message to everyone again today is your effort and your sacrifice is working and has been proved to work. Today, the number of COVID hospital admissions is falling, the number of patients in ICU is falling. We've so far succeeded in the first and most important task we set ourselves as a nation, to avoid the tragedy that engulfed other parts of the world. Because at no stage has our NHS been overwhelmed. No patient went without a ventilator. No patient was deprived of intensive care. We have 5 of the 7 projected Nightingale wards. And it's thanks to that massive collective effort to shield the NHS that we avoided an uncontrollable and catastrophic epidemic where the reasonable worst case scenario was 500,000 deaths. And so I can confirm today that for the first time we are past the peak of this disease. We're past the peak and we're on the downward slope. And we have so many reasons to be hopeful for the long term. The UK is leading international efforts to find a vaccine. Today, Oxford University has announced a partnership with AstraZeneca to develop what they believe could soon be a means of inoculating ourselves against this disease. But until this day comes, and I'm afraid we cannot say exactly when it may be, we're going to have to beat this disease by our growing resolve and ingenuity. So I will be setting out a comprehensive plan next week to explain how we can get our economy moving, one, how we can get our children back to school, back into childcare, second, and third, how we can travel to work and how we can make life in the workplace safer. And in short, how we can continue to suppress the disease and at the same time restart the economy. A huge amount of work has been going on that plan, and of course, as we produce it, we are being guided by the science, and we will try to build the maximum political consensus as we produce it across all parties and across the UK. But there will be 5 key tests that we must satisfy before we can put that plan into action. We must be sure that we can continue to protect the NHS and its ability to cope. Number 2, we must see a sustained fall in deaths. 3, we must be sure that the infection rate is falling. 4, we've got to overcome the operational and logistical challenges on testing and PPE. 5th, and this is the most important, we must all make sure that the measures we take do not risk a second spike that would overwhelm the NHS. We've come through the peak, or rather, we've come under what could have been a vast peak, as though we've been going through some huge alpine tunnel. And we can now see the sunlight and the pasture ahead of us. And so it is vital that we do not now lose control and run slap into a second and even bigger mountain. And so to avoid that disaster, our 5th and final test is that nothing, as I say, we do should lift the R, or the reproduction rate of that disease, back above 1. And before I hand over to Patrick, I'm going to ask for a short explanatory clip about the 1. And before we come to that clip, let me just emphasize, keeping the R down is going to be absolutely vital to our recovery, keeping the reproduction rate of the disease down. And we can only do it by our collective discipline and working together. I know we can do it because we did it, we've shown we can do it in phase 1 of this disease. This country came together in a way few of us have seen in our lifetimes to protect the NHS and to save lives. And that's why I'm absolutely convinced we can do it in phase 2 as well. Can we play the video now?
The government has set out 5 tests that must be met before we begin to adjust social distancing measures. One of the most important tests is the rate of infection. We have to make sure this is decreasing. All viruses, like normal flu, have a rate of infection. Scientists call this R. R is the average number of people one infected person passes a virus onto. To beat coronavirus, we need to keep R as low as we possibly can. Imagine 100 people are all infected. If R is more than 1, then those 100 people will infect more than 100 people, and in turn, they will infect even more. The virus is spreading quickly. If R is less than 1, Those 100 people will infect fewer than 100 people, and in turn, they will infect even fewer. The rate of infection is slowing down and coming under control. Scientists around the world have been tracking the R of coronavirus since the start of the outbreak. In March, at its peak, R was around 3, which seems to be the natural rate for this virus. Since then, thanks to you and the social distancing measures you followed, we've been able to reduce R, and it is now below 1. But we've only just passed the peak of the virus, and it's vital R stays below 1. Over the coming weeks and months, the government will be monitoring R very carefully. It will be a key factor in how social distancing measures are used in the future.
Good. Well, I hope that was clear and useful. Patrick, any update, please?
Thank you. Can I have the first slide, please? So, as the Prime Minister has said, there are 5 tests that the government has laid down for adjusting the lockdown. And what I'd like to do is just go through some of the data in terms of the epidemic and so show you where we are. Next slide, please. So, the R is below 1. We think it's between 0.6 and 0.9 across the nation. Maybe a little lower in some places, a little higher in others, but it's below 1 across the country. This shows the number of new cases, but as I've said before, this only really shows in the blue the cases in hospital, and then in the orange the cases that have been tested outside, so it's not the total number of cases. We know that the total number of cases is on its way down. You can see in the blue bars here that the number in hospital, you can see, is coming down, and of course the orange bars represent others who've been tested, including essential workers. But the number of infections will be coming down. Next slide, please. This turns into a reduction in hospital admissions for COVID, and this is the NHS data, so this is England-only data. But what you can see here in the blue is inpatients newly diagnosed with COVID, and in the orange is new inpatients with confirmed COVID at the time of admissions. So these are new admissions into hospital, and you can see very clearly from the 20th of March there was a rise up to a peak somewhere at the beginning of April, and now it's come down. So the number of cases is coming down, hospital admissions are coming down. Next slide, please. And that, of course, translates into the number of people in hospital with COVID, and this shows the data across the nations and in different regions. You can see very clearly the decrease in the number of people in hospital in London. You can see a slightly flatter situation in some other places. We need to make sure and to stick with what we're doing in order to get the R down further, to continue to keep it down, and to make sure that the number of people in hospital comes down right the way across the nation. But you can see the trend here to decrease. That in turn leads to the question of how do you get the critical care beds down? And again, when you look right the way across England, Northern Ireland, Wales and Scotland, the number of patients in critical care and those on ventilators is coming down right the way across. It's coming down slowly, as you would expect, but it's on its way down. Next slide, please. And that in turn starts to lead to the decrease in deaths. And here you can see the number of deaths in all settings. So this isn't just hospital, this is across all settings. And you can see it's gradually beginning to come down. It's not coming down as fast as it went up, and I've said before, I expect there to be a bit of a plateau stage here before things really come down further, but you can see it's on its way down. Final slide, please. And again, this is the comparison. It's difficult to actually look at exactly what this means because people record things differently, but the message is R is down, the number of new cases is down, that's turning into fewer admissions, fewer people in hospital, fewer people in intensive care, and we're beginning to see that decrease in deaths. Thank you.
Thanks very much, Patrick. Well, we're going to go first to members of the public who've got some questions to ask us. I'd like to hear from Michelle in Cornwall.
We are getting inquiries daily to book a holiday let from June onwards. We are worried there will be an influx of people coming away from the cities and to the tourist hotspots, which could bring a second wave to areas such as Cornwall. Please can we ask how tourism within the UK will be managed in the coming weeks?
Well, thanks, Michelle. And first of all, I want to, obviously, I sympathise very much with everybody in the tourism industry who's taken such a hit. And it's been one of our jobs to make sure that we look after businesses as far as we possibly can through our loans, our support schemes, to our furloughing schemes for workers. You will come back, Michelle. We are going to make sure that the UK bounces back as strongly and as fast as we possibly can, but we've got to be sensible. I think the public have been very sensible so far in staying away as far as they in obeying the advice. It's vital, as I say, that does not fray, and we don't see people starting to disregard what we're saying. But we will be saying, as I say, a lot more next week and in the coming weeks about how and when we propose to unlock the various parts of the UK economy. What you're going to get next week is really a roadmap, a menu of options. The dates and times of each individual measure will be very much driven by where we are in the epidemic, what the data is really saying. And we're getting in a lot more data every day now in the course of the next few days. So, Michelle, the short answer is you're dead right. We've got to get your business going again. We've got to get tourism going again, but we can't allow such a big influx of tourists as to create a second spike, a second wave of the disease. Chris or Patrick, is there anything that you want to add to that? Okay, I hope that's okay, Michelle. Thank you very much for your question. Katie from Liverpool. Well, Katie asks, the lockdown has seen an increase in suicide. What help is available for people experiencing a mental health crisis? And clearly this is a major issue that we've been thinking about. People confined at home can become more prone to existing mental health conditions, and so that's why it's very important to understand taking the pressure off the NHS in the way that we have means that we can now, as Matt Hancock said, I think on Monday, we can now make sure the NHS is once again prioritising other urgent care needs across the community, including people's mental health needs. And Public Health England is doing a huge campaign to reach out to people who have mental health needs, who are feeling in need of comfort in what is a very, very difficult time. If you're experiencing it yourself at home, then there are lines that you can call. Go on our website, gov.uk, to see what you need, and we are putting money now into mental health care charities across the country to support what we I agree very strongly with Katie from Liverpool, is an issue that needs to be addressed, and goes to show why it's all the more urgent for us now to begin to come out of lockdown, but to continue to suppress the disease. Happy with that answer, more or less?
Absolutely. The only thing I'd add to that is if you go onto the NHS website, there are contact details both for NHS things that are available for people who have mental health issues or are feeling lonely, or indeed, in this case, suicidal. There are also many remarkable voluntary organisations, yes. Ones that are well known, like the Samaritans, but there are others as well. And I would strongly encourage anybody who is feeling they're going into a mental health crisis, or feeling suicidal or very, very low in mood, please do look up those numbers and go to one that's relevant to your particular needs and call someone, because there are a lot of people out there who would be very keen to help you.
That's absolutely right, and that goes really for anybody who is stressed out by the current situation. People who, where the atmosphere at home has gone wrong. People who feel at risk of domestic abuse, in particular. There are helplines for you. It's absolutely vital that people should use them. And as I say, one of the reasons why we don't want there are good practical health reasons why we don't want to protract this lockdown any longer than it needs to be protracted. Okay, let's go to the media. Could we go to Laura Koonsberg from the BBC?
Thank you very much, Prime Minister. There's been such huge suffering. There have been 26,000 deaths since you last stood at that lectern. There's been huge suffering to people's health, but also to the country's wealth. Many people are very, very worried about making ends meet. By continuing with lockdown, are you telling the public that the economy just has to wait? And if I could ask Sir Patrick or Professor Whitty, you say the R is now between 0.6 and 0.9. What level does the R need to be at before you would be comfortable with starting to ease the restrictions?
Well, thanks very much, Laura. And what you say is, of course, totally right. And we mourn for every life lost, and we mourn for the economic damage as well that the country is sustaining, and for people's the dreams of people's that they're seeing shattered in their businesses, their anxieties about their jobs. We totally understand that. As you know, government has made a huge effort to look after workers, to protect them with our furloughing scheme. Colossal sums in loans are going out of the door. We're doing everything we can, and I think I really pay tribute to Rishi Sunak, the Chancellor, for the speed with which he's come forward with the schemes that he has. I do think that the UK has done very well by comparison with a lot of places around the world. But it's absolutely vital, Laura, that if we're to bounce back as strongly as I think we can, that we don't have a second bout of this, a really second bad spike, because that would really do the economic damage. And that's why we've got and lasting economic damage. And that's why we've got to calibrate our measures so carefully and make sure that we not only unlock the economy gradually, but also find ways of continuing to suppress the disease, and possibly new ways and more ingenious ways of suppressing the disease as well. And that's what we're working on now, and you'll be seeing a lot more of that, I hope, next week. Chris and then Patrick.
There isn't a perfect answer to what should the R be, except we are absolutely confident that the wrong answer is anything over 1. Because as soon as R goes above 1, then you restart exponential growth. It may be slow if it's just above 1. It may be a lot faster if it goes a lot above 1. But exponential growth restarts, and sooner or later, and the higher it is, the sooner it is, the NHS will go back to the risk of being overwhelmed, and the numbers of cases will tick up. It is also important, though, from a health point of view, to emphasise one other thing, which is I've talked before about the fact you have the direct deaths from coronavirus, but also indirect deaths, part of which is caused by the NHS and public health services not being able to do what they normally can to look after people with other conditions. And it is therefore important, at whatever point we're at, that the NHS not only has the R below 1 or at or below 1 at all times, preferably significantly below in an ideal world, but certainly below, but also that it has headroom which allows it to operate not just in doing the emergency things, which it has managed to maintain throughout the entire coronavirus first phase, but also to do the other important things like urgent cancer care, elective surgery, and all the other things like screening in public health preventive terms, which we need to do to keep people healthy. So this is those two things from my perspective as someone who's responsible for talking about health and thinking about health as Chief Medical Officer. Absolutely, those two to me seem critical.
I completely agree with that, and I think it's worth just thinking, at the beginning of this, we talked about the doubling time of the epidemic. We're now talking, because the R is below 1, of the halving time of the epidemic, and we want to keep it going down, so it has to be below 1, and then we need to get the numbers down to a level which is manageable and gives us some headroom in order to be able to make changes.
Thanks very much, Laura. Can we go to Robert Peston of ITV?
Good afternoon, gentlemen, and good to have you back, Prime Minister. You made the important point that we've avoided the reasonable worst case of 500,000 deaths, but by your own chart, the death toll in the UK is possibly the worst in Europe, certainly amongst the worst in Europe. As we head into the second phase, what lessons have you learned from that seemingly worrying outcome? And secondly, because of the unprecedented help you are giving to struggling individuals and struggling businesses, the national debt is rising by hundreds of billions of pounds, a record amount in peacetime. Prime Minister, how great a risk is there that when we are through this crisis, you will feel compelled to cut public services and move us back into a new era of austerity?
Okay, well, look, first of all, Robert, on the UK's international comparison, I think it's very, very important that people should understand that the collating of data internationally is bedeviled with difficulties, and comparisons are very, very difficult. And actually, I think that the only real test, the only real comparison is going to be possible at the end of the epidemic when you look at total excess deaths. And I'll ask Chris or Patrick to say a bit about that. And so I genuinely think, when I look back at what the UK has done, I think that, and by the way, when we put in the lockdown, it was earlier in the curve of our epidemic than it was, relatively speaking, in France and Italy and Spain. I think we did the right measures at the right time, and don't forget that people are talking about the difficulties of lockdown. There's some very good questions about mental health, suicides. It's a very, very demanding thing to ask a population to do, very tough. And so I think it was completely right to make our period of lockdown coincide as far as we possibly could with the peak of the epidemic. That peak, as I said just now, has passed. I do think that, broadly speaking, and we're learning lessons every day, Robert, we're learning lessons every day. But I do think that, broadly speaking, we did the right thing at the right time. And, since you make international comparisons, let me remind you that at the time we had to take those very difficult decisions, we were looking at a situation in which it seemed all too plausible that people would not get ventilated beds in the way that was happening in other countries. And it seemed really possible that people would not have access to intensive care, as we were seeing happening tragically in some other places around the world. And together, this country really did come together to protect the NHS, to enforce, to obey the social distancing rules, and to save lives. So overall, I'm not going to pretend that we're not learning lessons every day. Of course, we're learning lessons every day. But those are the conclusions that I draw. And on the international data, wait and see, till the end of the epidemic. On your second big picture question, which is an entirely legitimate one, well, you know what my instincts are, Robert. I think the economy will bounce back strongly. I think that this government will want to encourage that bounce back in all kinds of ways. But I've never particularly liked the term that you just used to describe government economic policy, and it's certainly not be part of our approach. Austerity, by the way, was the term you just used for viewers who've forgotten what Robert said. Sorry, Chris and Patrick.
When I come from a profession, as Patrick does, where learning the lessons after you've gone through something is absolutely critical. Totally accept the basic premise of your question, which is we must learn lessons at the right point. But what you don't do, frankly, is do that in the middle of something. We are nowhere near the end of this epidemic. We are through, and it is very good, as the Prime Minister said, we're through the first phase of this. There is a very long way to run for every country in the world on this. And I think let's not go charging in to who's won and who's lost at this point. Let's actually try and take it quite carefully, learning lessons from one another as we go along. But if you want to see how this actually is difficult to do technically. There's an excellent article in today's Guardian by Professor David Spiegelhalter, which is actually lays out why comparing COVID deaths, as you see on the graphs, is very, very difficult to do and should be done with extreme caution. I've said repeatedly, and I will say again, the metric we should be using when we do get to the point this is the right thing to do, which is definitely not yet, is all-cause mortality adjusted for age. That is the key metric. We've discussed it today amongst a lot of the scientists. Everybody agrees this is the key metric. And the reason for that is every country measures its COVID cases in a slightly different way. So comparing it with them to one another is largely a fruitless exercise. But there are comparisons to make, and there are certainly technical things all the time we can learn from other countries, and to be clear, other countries can learn from us. For example, the ability to get people into trials at the moment is something where the UK is taking a very leading role. So I think lessons go in every direction, but I think let's do the post-action review, which we absolutely must, at the right moment, and we are definitely not at that stage yet, sadly.
Absolutely nothing to add.
Thank you so much. Thanks, Robert. Dan Wootton, Talk Radio.
Experts believe there is a ticking cancer time bomb as a result of this crisis. Professor Carol Sikora and a group of leading oncologists predict that 60,000 extra cancer patients could die as a result of a lack of treatment and a lack of diagnosis. So, Professor Whitty, first, have you done any similar modelling? And if so, can you give us an idea of what those numbers look like? And Prime Minister, as we move into the second phase of the lockdown, can you guarantee that anyone who needs life-saving cancer treatment will be able to get it?
Christian.
Well, we've looked actually across the board. So throughout this, what I've said is there are 4 ways in which people will suffer ill health and die as a result of this epidemic. Directly from COVID, which we've been talking about. Indirectly because the NHS is overwhelmed, which, as the Prime Minister has said, is one of the things that we've managed to avoid so far and are determined to continue to avoid. But the third group is all the things which, under normal circumstances, health and preventative service would be doing, but which it is not able to, because efforts have had to, for the NHS and public health have had to be reoriented. And then finally, the impacts of increasing deprivation. Now, on that third group, which is the one you're talking about, it's not just cancers, actually. We're very concerned, for example, that there has been a fall away in people coming to accident emergencies, to emergency hospital things, with things like strokes and heart attacks. They must be going on. And one of the worries we have is that people are thinking, well, I can't go to the NHS because it can't deal with these emergencies. It definitely can. But you are absolutely correct that what we are very determined to do is to make sure that as much of normal non-emergency services for the NHS and public health are switched on in a responsible way, where we can do it in a phased way, to ensure that the period where actually there has been a delay is minimised, and to prioritise the things that are the most urgent first, and then other things which are as important but are less urgent, we kind of do slightly later in the system. And a lot of thought from my NHS and public health colleagues is going into how you get that phasing back on again right.
Yeah, well, Dan, you're asking an incredibly important question, because I think one of the things we've become increasingly concerned about as we've seen the decline in COVID cases in the NHS, particularly in intensive care and elsewhere, is are we seeing an unnatural displacement? Are people frankly reluctant, scared to go to hospital when they should be going to hospital? It's very important if people have urgent conditions that need treatment, they should go to hospital. And I can certainly say that when it comes to urgent cancer care, Dan, people will get the treatment that they need. And let's be absolutely clear about that. Can we go now to Francis Elliott of The Times?
Hello, Prime Minister. You've made the R rate the kind of guiding star of your policy going forward, but you can only say that it's somewhere between 0.6 and 0.9. That's quite a wide range of uncertainty there. Can I press again on what is a manageable R rate going forward, and what are manageable numbers that Professor Vallance talked about? And secondly, you've also talked about that you'll give some guidance to safer workplaces next week. can we, and transport, can we expect some clarity on face masks, please?
Yes, okay, both points. Look, thanks, Francis, very much. On the R, and I'm going to sort of give my layman's account of it, and I hope that Chris and Patrick may want to either to correct me or explain further. On the R, at the moment, there are different R's in different environments, and the crucial thing is to stop the overall national R from going over 1 again, because as Chris has and Patrick have explained, that's the moment you get the risk of another exponential curve upwards. I think that the change now in where we are is that we're starting to get much more and much better data about where things are, and that will continue to improve, so that as we go forward with our plan for phase 2, we'll be much more sophisticated in the way that we're able to respond to what we think may be changes in the R, whether locally or regionally or indeed nationally. I hope you understand what I'm saying, but I think the people need to understand that driving down the R is, of course, our collective endeavour, and the better we can do it locally, nationally, and across the country, the faster we will be out of it. And on your second excellent point, which was about masks and face coverings, I think what, and again I'll defer to Chris and Patrick, but what I think Sage is saying, and what I certainly agree with, is that as part of coming out of the lockdown, I do think that face coverings will be useful, both for epidemiological reasons, but also for giving people confidence that they can go back to work. And you're going to be hearing more about that and that kind of thing next week.
Shall I deal with the R? At the moment, we're using a calculated R, looking at all sorts of things, including contacts, looking at genomics, looking at data from ambulance, hospital admissions, and so on, to calculate the R. And it's right that it's got a range. It would be falsely precise to say we know exactly what it is, and different models give slightly different rates. And as the Prime Minister has said, it's not exactly uniform across the country. In London, it's probably somewhere between 0.5 and 0.7. What we're doing now, which is a really important part of this going forward, is actually measuring the R by measuring the number of active infections in a random population survey. That's going on this week, it'll go on next week, it'll go on the week after. So we start to get a measured value of R, and that together will start to help us refine exactly where the R is. And it's always the case in an epidemic. You get closer and closer to a precision value. It's never going to be absolutely precise, but we will narrow it down, and it'll be more of a measured R, which I think is an important point.
Chris, anything to add? Okay, good. Thank you. Thanks very much. Thanks, Francis. Richard Vaughan of The Eye.
Hello there. Following on from Francis's question, really, given you have a better idea of how many people are actually infected, what figure do you think you need to get to in order for test and trace to be effective? And Prime Minister, if I may, you've obviously contracted COVID-19 yourself and needed serious hospital treatment. Has it changed your approach to tackling the crisis at all?
Okay, well, I'm good. Thanks very much, Richard. I mean, on how far you need to get the new cases down, the R down, to be able to do, as new cases is the key variable there. I think probably I'll ask the scientists to answer on that. Chris and Patrick.
You can do things like track and trace at any stage of the epidemic, but it has a greater effect and a higher proportion of the heavy load can be taken by it if you're doing it at a much lower level of numbers of cases a day. That, I think, is broadly the answer. I mean, putting exact numbers on that, there's no really precise way of doing that, but this is one of the things that modelling groups that Sage and others have looked at in a lot of detail, and indeed Patrick and I were discussing this with a lot of teams earlier on today, because we need to look at the range of possibilities. But to be clear, there isn't a magic number, but in broad terms, the lower the number, the more effective it'll be as an intervention. Thanks.
Yes, so Richard, on your question about my own case. Look, I mean, I was very, very lucky. I had wonderful care, as I've said, wonderful treatment, and let's be frank. Tragically, thousands of people have been less fortunate than I was, and that's why, you know, the objective of this government is to save lives across the country, to minimise the suffering that this epidemic is causing and is going to cause. And that's been our objective, frankly, from the beginning. It's unchanged. It will continue to be our objective. Thanks very much, Richard. Can we go to Alex Wickham of BuzzFeed?
Hello, Prime Minister. The NHS has stayed under capacity, which is obviously a good thing. But given the number of spare ICU beds available during the peak, why is the UK's death rate so high, particularly in care homes? And for the experts, in the US last night, Anthony Fauci said that the antiviral drug remdesivir had a clear-cut effect on reducing recovery time and was proof that drugs could block the virus. The PM just now mentioned some other ways that we might be able to manage this later on. Do you two share that confidence about remdesivir? And is the UK working on procuring this drug for Britons?
Alex, I think on your first question, I'm really going to, if you know, I think there'll be all sorts of discussions about all sorts of factors, comorbidities and so on, that increase the risks of coronavirus in this or that country. There's a huge debate already opening up. I think really what I'm going to do is sort of defer to the answer that Chris gave earlier about the vital importance of waiting to the end before making these international comparisons and just looking at the total excess mortality and trying to draw some lessons and some conclusions there, because at the moment I just think the data is not clear. And on the other point, I defer on remdesivir. I defer to the experts.
Yes, happy to speak to that. So remdesivir is a drug that was made for Ebola and has been tried for COVID. It absolutely does hit a particular part of the virus. That's been shown. Actually, there are some structures of proteins from the virus which you can show the drug binding to. And there are two big studies that have reported out, one from China and one from the US. The one from China was a bit smaller. It didn't show any overall benefit in terms of outcome, and it was stopped early, partly because the number of cases were decreasing. The one in the US, which is a bigger study, showed a benefit in terms of the time to recovery, so down by about 4 days. It didn't have a statistically significant effect on death, although it looked like there were fewer deaths, well, there were fewer deaths in that group, but it wasn't statistically significant. So I think the answer is this is a really promising first step. In other words, it shows that if you've got a drug that you know binds to a bit of the virus and inhibits it, you can actually get some effect. And that effect isn't very large at the moment. It could get bigger as more studies are done. There are other studies going on at the moment. The UK has been part of those studies. But it's a very promising first start. It's definitely not a magic bullet to cure this, but it does show that drugs are going to be possible to have an effect on this virus, and therefore there'll be more that come along, and ultimately it may need to be a combination of drugs that comes together to make this really effective.
Can I just add two things to that, all of which I also agree with. The first thing is, and this is the cautious medical scientist in me, that you should always wait until you've seen the published paper that's been peer-reviewed in a journal before jumping to conclusions. So we've had a very encouraging verbal report of this. I think let's see the data before we overinterpret where we are, but clearly an encouraging first step. And the second thing, just building on Patrick's point, is I think people often imagine that you move suddenly from a situation where you have no treatment or no vaccine, particularly, this is true for treatment, to you suddenly have the treatment. Actually, what tends to happen is by incremental steps, you move forward, things steadily improving, sometimes combinations of drugs start, each one of which has a small effect, but if you put them together, the additive effect is very considerable. So I should think we should see this as an encouraging, provided it holds up on the publication, first step along a long path towards significantly better treatment for this disease. But I am very confident that if we looked back at this disease from 1 or 2 years out, we will have significantly better treatments in the future than we have today. And my final point is I'd really like to thank those in the UK who are taking part in clinical trials, because the way that you actually learn about drugs and for the future help to improve treatment for others is for these trials to go on. And the trials in the UK are recruiting at an absolutely extraordinary rate due to people volunteering.
So a first step, one that says, yes, it is going to be possible to do something. There'll be more work to be done to get more drugs out on this.
Thanks very much, Alex. And can we go finally to Joe Byrne from the Stoke Sentinel?
Hi, good afternoon, Prime Minister and gentlemen. Can you hear me?
Yes, well.
Okay. Stoke-on-Trent's key workers are being told they must drive an 80-mile round trip to Manchester Airport for coronavirus tests. Many workers in need of tests don't drive or have access to transport. There is a testing facility at Stoke City's Bet365 stadium, but it's only for emergency workers and the NHS. Will the Prime Minister make more testing available for essential workers in Stoke-on-Trent, and will the Bet365 testing be expanded to include all key workers and their families? And for Chris and Sir Patrick, I think you just touched on this, but given that 600 patients at Royal Stoke University Hospital are undertaking drug treatment trials to combat the virus, how vital of a role are Royal Stoke patients playing in reducing the overall number of deaths through these trials?
Well, thank you very much, Joe. And first of all, thanks to all key workers in Stoke. Thanks to the entire people of Stoke for what they're doing to help us collectively to get this virus down, get it under control, to pass the peak in the way that we have done today. Thank you for bringing to my attention this point about the 18-mile round trip for testing. We'll bring it up immediately. I'll check it out immediately with the NHS and with the huge team that we now have responsible for testing. You're going to be hearing a lot more in the course of the next couple of days, as you can imagine, about where we are with testing. You heard me say earlier on today that we've got the numbers up to, I think, 86,000 plus, but there is clearly a massive way to go. In principle, every key worker in this country should be able to get a test. And we want that to happen. We're massively ramping up testing, and I think I'm right in saying, though I know that Matt Hancock will undoubtedly be telling you more about this tomorrow. I think I'm right in saying that we're now doing about as much testing as any other country in Europe. If you look at the more recent figures, I know we're supposed to deprecate these international comparisons, but we have massively ramped up our testing operation. We're going to ramp it up even further. And on your specific point, Joe, about making sure that key workers in Stoke get the tests they need on time without having to do an 18-mile round trip. The best I can tell you is that we'll be onto it, and we'll come up with a way to ensure that they get the tests they need without going through that kind of palaver. So I want to wrap up this session.
Second one.
Oh, sorry.
Trials, yes.
Trials.
So
the second question was. Sorry,
trials in Stoke.
I don't want to wrap up without hearing Chris. Sorry.
It's really extraordinary that so many people in Stoke, and indeed many other cities around the UK, but absolutely in Stoke, have volunteered for this. And I'd just like to say a huge thank you on behalf of future patients who are going to actually benefit from the fact that people have volunteered to do this. And that means we will learn, as Sir Patrick says, as new drugs come through, as old drugs are tested against this, and we will be able to treat this better. And that will be down to people who, in Stoke and elsewhere, who are taking part in these trials. So enormous thanks.
I echo that. It's incredibly important. It's the only way we can find out what works. It's really generous of people to volunteer for this, and it makes a massive difference, because otherwise the world's full of anecdote. And what this does is allow you to really understand what works and what doesn't. So big thing. Thank you.
Thank you very much, everybody, and See you all again in the course of the next few days. Thank you.
to everybody who needs it. In today's briefing, after setting out the daily statistics, I want to talk about testing. But beforehand, I'd like to share some really good news. Earlier this week, I said that we are now able to begin the restoration of NHS services. Now that we're past the peak, I can tell you about the next step, the restoration of fertility services. Few families have been untouched by the amazing advances in fertility treatments over the past generation. And I know just how time-sensitive fertility treatment can be and how important it is for the families affected. And I know that this treatment can change lives for the better forever. So when I say thank you to all of you, everybody watching, for staying at home to protect the NHS, of course I'm saying thank you on behalf of the lives that you're saving. But I'm also saying thanks on behalf of the lives that the NHS can now once again help to create. Because together we've protected the NHS, and we're now restoring the NHS and restoring the chance for so many couples to start a family. Turning to the figures, 177,454 people have tested positive for coronavirus, an increase of 6,201 since yesterday. 15,111 people are currently in hospital with coronavirus, and 27,510 people have now sadly died across all settings, an increase of 739. As one, we'll remember them and treasure their memories. This is a virus that has a devastating impact on families, on friends, on local communities. And right across government, we're working day and night to defeat it. At the beginning of last month, at this podium, I set a goal that anyone who needs a test should get a test. And that as a nation, we should achieve 100,000 tests per day by the end of the month. I knew that it was an audacious goal, but we needed an audacious goal because testing is so important for getting Britain back on her feet. I can announce that we have met our goal. The number of tests yesterday, on the last day of April, was 122,347. This unprecedented expansion in British testing capability is an incredible achievement, but it is not my achievement. It is a national achievement, achieved by a huge team of people working together. And I tell you this, the testing capacity that we've built together will help every single person in this country. Testing is crucial to suppress the virus. I know from personal experience too, just how much people with symptoms want to know if they've got the disease. I know that I did. It helps remove the worry, it helps keep people safe, and it will help us to unlock the lockdown. So many people have tragically died, and the challenge that we still face is vast, but we're making real progress. I want to take a moment to thank and pay tribute to the incredible team who did this together and who joined in one of the greatest national mobilisations that we've seen. We brought together the best civil servants, the best minds from the private sector, the best scientists, the best lab technicians, and the best of the best in the armed forces. Setting stretching, ambitious goals in a crisis has a galvanising effect on everybody involved. It is a mission. If we hadn't been so bold, if we'd chosen a safer, easier path, I just can't see how we would have built the capacity that we need. In a few short weeks, we've created a new test for the virus in PHE. We've built a network of regional testing centres. We've put a fleet of mobile testing units on the road and created home testing kits. So if you can't get to the test, we can get the test to you. We've more than doubled the capacity of NHS and Public Health England labs and created 3 brand new mega labs to analyse the results. So many people have played a part in this work. British diagnostic companies like Randox and Oxford Nanopore and Medical Wire and DNA Nudge and Samba, logistic companies like the Royal Mail and Yodel, who were brilliant and got us out of a real hole this week, academics like Professor Derek Crook and Sir John Bell from Oxford and Professor Aradazai from Imperial, Deloitte and Boots, who've delivered our drive-through centres, AstraZeneca, GSK, Novocyte, whose labs go on stream next week, Public Health England and the NHS, of course, who've pulled out all the stops, Professor Sharon Peacock, Professor John Newton, and the UK Biocentre and the CRIC, who set up high-tech laboratories. And also, it wasn't just a national effort. People from across the world, including Thermo Fisher, Hologic, Abbott, and Amazon from the US, QIAGEN from Germany, and Roche from Switzerland. And this is how we did it, because everybody worked together with grit and determination to reach a shared goal. And they thrived because the team contained diversity of perspectives, of backgrounds, and critically, a diversity of thought. And when things went wrong, which they did every single day, believe me, we didn't ask who we could blame. We asked how we could fix it. So to my team, I want to say you toiled tirelessly, night and day, and I'm so proud of what you have achieved. And to all of you, on behalf of government, on behalf of the whole country, thank you. As the Prime Minister said, a big increase in testing provides a way to unlock the puzzle of coronavirus. And testing forms the first element of our plan to test, track and trace. By mid-May, we'll have an initial 18,000 contact tracers in place. That work is underway as we speak, and if it needs to be bigger, we'll scale it as required. The combination of contact tracers and new technology through our new COVID-19 NHS app will help tell us where the virus is spreading and help everyone to control new infections. People will be able to know if they've been in close contact with someone who's transmitting the disease and take the action that they need to. Our full-scale test, track and trace model will drive the infection rate down, and the lower the R and the lower number of new infections, the more effective the track and trace system will be. Tracking and tracing will allow us to get R down and hold R down, and so it will allow us to lift lockdown measures. Now, this disease affects us all indiscriminately. We've seen that. In recent weeks, we've had to impinge on historic liberties to protect our NHS and our loved ones. And yet our goal must be freedom. Freedom from the virus, yes, and we will not lift measures until it is safe to do so. But also, we care about the restoration of social freedom and economic freedom too. Each citizen's right to do as they please. For now, we're working together to stay home. We're impinging on the freedom of all for the safety of all. With this next mission of test, track and trace, I'm seeking a solution that allows us, by each of us participating, to target the measures that are needed with much more precision. And so to reassert, as much as is safely possible, the liberty of us all. That is our next mission. But for now, the most important thing for everyone to do, to keep R down and to get us all through this, is to maintain the spirit and the resolve that's had such an impact thus far. So please, stay at home, protect the NHS, and save lives. And now Professor Newton is going to set out some more details on testing, and then I'm going to ask Professor Powys to set out and take us through the slides.
Thank you very much, Secretary of State. And can I also thank you on behalf of the programme for those kind words of thanks. It's been a truly extraordinary collaboration, but thank you very much. We have reached an important milestone, but I want to explain why we need all this testing. Back in March, the country moved into lockdown because the virus was circulating widely, not because we did not have enough tests. Cases were popping up with no obvious connection to other cases, and the infection was entering the exponential growth phase. And at that point, access to limitless testing, even if we had had it, would have made no difference. The decision to enter lockdown would have been the same and would have been taken at the same time. In the same way, the route out of lockdown has not been blocked by low levels of testing. We can relax social distancing only when the government's 5 tests are met, and that means particularly getting the infection rate right down. Testing will, as Secretary of State has mentioned, help to keep it under control once we're out of lockdown. But our levels of testing have not kept us in lockdown a day longer. What about Germany? People talk about Germany a lot, but yes, Germany had a lot of tests available from the get-go. But there was also a lot less virus around in Germany when they introduced social distancing, and it was circulating in younger people. So, as CMO pointed out in an earlier briefing, we should not rush to draw conclusions about relationships between numbers of tests available and outcomes in different countries. Nevertheless, as CMO also said, we are learning from other countries, and we have learned from the experience of other countries. But back to the here and now, where does all this leave us in the UK? Well, the 100,000 tests a day target was set for 2 purposes. As Secretary of State has mentioned, it was intended to motivate the programme and set the scale of our ambition, and it has certainly done that. More importantly, though, perhaps, we knew from our calculations that we would need something like this level of testing to be ready for the next phase of the response to the pandemic. Looking to the future, then, we now have a very substantial and flexible testing capability in the UK. It will be used to drive extensive contact tracing to control any new infections, to help us keep patients and staff safe in hospitals and care services, and to tell us with some precision how the virus has spread across the country and is spreading in the future. If we can quickly identify who may have been in contact with someone infected, we can prevent them from passing it on and so drive down transmission rates of the virus. Now, the new NHS app for contact tracing is also in development and making rapid progress. And the more people who sign up for the new app when it goes live, the better informed our responses will be, and the more effective we will be in keeping the virus under control. All this progress with testing and with our design of the next phase of contact tracing and the app frees ministers and their scientific advisors to choose whatever future strategies are best suited to keep the country safe. I can assure you that the testing capability we have built in the last few weeks is world-leading in its scale and sophistication and gives us the flexibility we need. As the pandemic evolves, we will have the testing capacity to meet changing demand across the country. It is now there to serve us all. Thank you.
Thanks very much, John. And Professor Pass, if you'll take us through the slides.
Thank you very much, Secretary of State, and good afternoon, everybody. So as I and others have said on many occasions, the magnificent response of the British public to the government's request to comply with social distancing instructions has meant that we have begun to get on top of this virus. We've seen the transmission rate, the reproduction rate fall to below 1, and that means that the number of new infections is falling within our communities. And that has meant that pressure has been kept off the NHS. The NHS has responded magnificently to make sure that patients have always had available the treatment they require. And over time, this also has an impact on the unfortunate number of deaths that we've seen. And as we move to the next phase of managing COVID-19, I think the first thing I'd like to do is to remind everybody of the 5 tests that the government has set for adjusting the current lockdown. The first I've already referred to, and that's that the NHS continues to have sufficient capacity to provide the critical care requirements that are needed, but also specialist treatment right across the UK. Secondly, it's that sustained and consistent fall in daily deaths from coronavirus, and we are beginning to see that, but we need to make sure that that is maintained. Thirdly, it's reliable data to show that the rate of infection is decreasing to manageable levels across the board. And again, as I've said, it's everybody's efforts in complying with social distancing that means that infections have fallen and will continue to fall. Fourthly, this has been a challenge, not just in the UK but globally, around the operational response to a pandemic. That includes PPE, it includes other things. And moving forward, we need to ensure that those challenges, testing is one of them, are in hand, and that we are in a good position going forward to meet future demand. And finally, and critically, that any adjustments going forward don't risk a second wave, a second peak of infections that again runs a risk of overwhelming our health systems. So those are the 5 key tests that have been set, and the government will be looking to be confident that it has met those before it moves to the next phase of the lockdown and the measures that we will need to take going forward to stay on top of this virus and ensure infection rates remain low. Now, in the next slide, I'm providing some details of exactly how the British public have complied. And the first is an example on how people have been approaching contact, particularly with vulnerable people, over a period in the middle part of April, showing that 84%, the great majority of adults, have said they'd either not left their home or only left their home for permitted reasons, and 87% of adults avoiding contact with older or vulnerable people. So again, great testament to the efforts that the British public have gone to ensure that we reduce infections. And then on the right of this slide, some information on the number of people who've been working at home since social distancing measures were introduced. And that's 45% of adults in employment saying that they work at home. And that compares to around 12% of last year. So again, a great increase in those that are not going out, that are staying at home and are managing to work without having to go in their usual place of work. And on the third slide, we begin to see the testing information. The Secretary of State said, as both Secretary of State and John have said, the number of tests have increased dramatically. But it's not just the fact the numbers have increased, it's the fact the capacity has increased so that we can use testing for a far wider range of purposes. And you have already heard some of the areas in which that is going to be critical going forward in the months ahead. In the fourth slide, we show the new cases as determined by positive tests. You will see that that has increased a bit in recent days, but that should be seen in the context that we have increased the number of tests in the round. So more testing and more testing of different groups of individuals is likely to bring more positive tests as a result. But overall, I think the number is relatively stable, and that is a good sign and reflects that the level of infection is falling. In the next slide, we then move to people who unfortunately, and again, it's a mild illness for the great majority of people, but for a proportion who do have to be admitted to hospital, you can see that since the middle of April, numbers of people in hospital with COVID-19 have been falling. And that's particularly marked in London, that was ahead in terms of the infection rate, and therefore that fall has come quickest in London. It is starting to move down, maybe at a slower level in other regions of the UK, but nevertheless, overall the trend is downwards. And then that also translates in the next slide to people who, again, small minority but important group that have to be treated in our critical care facilities. This shows the proportion of people with COVID-19 in critical care beds, and again that is falling in the 4 nations. And the absolute number of people in critical care beds, so not just the percentage but the absolute number, is also declining. And then finally we move unfortunately to deaths, the sad deaths that have occurred. And again, we're now showing deaths in all settings. We were previously, up until a few days ago, showing deaths in hospital settings. We've now expanded this. And again, you see those numbers do vary from day to day, and there's a reporting lag at the weekend. But overall, the 7-day rolling average, which smooths out those that daily variation, is showing that the number of deaths is beginning to trend downwards. And then very finally, we show the usual international comparison against other countries. And again, this comes with the usual caveat that this sort of comparison is really important. It's now UK all settings, but the real comparison is in all-cause mortality, so in excess deaths in countries. That is measured more consistently between countries, but there will be some time before that analysis can be done. So although it's important to show this data, I think it's important to remember that it will be a number of months and perhaps longer before we can see the true comparison between countries. So finally, to remind people that the hardships we've been going through, the compliance with social distancing is working. The key thing is it needs to continue to work, so we all must continue to not think that this is over, this is really the beginning, but it is translating into benefits in pressure on the NHS and on reduction in deaths, so it's important that we all keep it up. Thank you.
Thanks very much, Steve. So the first question is going to be from Andrew from Leeds, who joins us by video.
Hello. My question is, when lockdown restrictions are lifted and schools open, will there be fines if people choose to keep their children off school, even if it's open for their age group? And also, how will you make sure the public is confident it's safe?
Well, thanks, Andrew. That's a really important question. Our aim is that when it is safe to do so, then we'll make recommendations of changes like this. But we will only do it when it's safe to do so. So we are not going to reopen schools if it isn't safe. Now, of course, this disease, thankfully, doesn't appear to give children symptoms nearly as bad as adults. So it is much, much, much safer for children. And maybe Professor Powis, you can add something on that. But we will not reopen until it's safe to do so. So that's on your second question. On the first question, of course, as and when we reopen schools, our goal is to get back to the norm and the position as it was before. And I'm confident that because we'll only do it when it's safe, then it will at that point then be entirely reasonable and become normal again to send your children to school.
Yes, so I think, as Secretary Davis said, it's perfectly correct that this virus affects children much less than it does the elderly and older adults. So they are much less affected by the effects of having COVID-19. There have, as we said the last time we were here, there have been some very rare reports about complications in children. We are continuing to look for that and try and understand if there is any link. But the overall message is for children, this is a mild disease or is one that produces very little symptoms. The science is still evolving in terms of transmission between children, so we do need to be cautious as we think about opening schools, and we will need to think carefully and advise the government appropriate advice as to how that might happen. But the key thing is that this is not a serious disease for the vast majority of children and indeed younger people.
In fact, it's important to remember, isn't it, that the reason that we had to take the decision to close schools was because of the impact of schools on transmission, yes, not on the safety of children. Exactly. And that's important to bear in mind, and I hope reassuring, Andrew. The next question is from Stuart from Redditch, and Stuart asks, given the large investment that's gone into creating the Nightingale hospitals, will we make use of them going forward to help reduce NHS waiting lists at the right time as we come through the pandemic? The answer to your question, Stuart, is that we will do what we need to do to reduce NHS waiting lists as we reopen the NHS. But the Nightingales were designed very specifically for patients who are intubated and therefore who are under anaesthetic. So they are specifically designed for COVID. But Steve, you were behind that project, so maybe you can set out more detail.
So Secretary of State is quite right. The Nightingale hospitals have been designed with specific purposes in mind. The Nightingale Centre in East London created in order to be used if we needed extra capacity for ventilated patients. Fortunately, we have used the Nightingale in London, but fortunately we have managed that surge because of the compliance the British public has shown to social distancing. So the NHS has done a great job. But those hospitals are designed in a particular way for a particular purpose. And that doesn't necessarily mean that they would be fit for purpose for other type of NHS activity. Now, of course, we also need to keep them as an insurance policy in the next month or two, because we need to be confident, as I said in the 5 tests, that we have a sustained reduction in hospital admissions. But of course, we will always keep things under review going forward. But I think the key thing is that the Nightingales have shown quite how agile the NHS can be with the support of the military if we need to be. But I think have given us that extra capacity that we have used but haven't had to use to the extent that we might have feared even just at the beginning of April.
Thanks very much. And thank you, Stuart, for submitting your question. Remember that you can submit a question by going on to gov.uk/ask. And I think these questions from the public are a great addition to our daily briefings. And we'll now turn to questions from the media. The first one is from Hugh Pym of the BBC.
Thank you very much, Secretary of State. As you said, there's clearly been a rapid and impressive expansion of lab capacity, and testing centres and businesses and staff have put in a huge effort and are fully deserving of praise. I wanted to ask a little more about where we go from here. In your view, you touched on it, but a little more detail. How do you intend to further develop and expand the testing network as part of moves to combat the virus?
Well, that's a really important question, Hugh. I tried to set out a bit of it, but I think there's 2 parts. The first is that we've grown this testing capacity to over 100,000, 122,000 tests done yesterday. And that's for a purpose, because by testing you can help to treat patients better. We've always been testing patients. You can help get people back to work, and there's been a big expansion of the eligibility to get a test in order to be able to get back to work. And also for surveys, and very soon we should get the first results of the surveys that are out in the field at the moment, so that we know how many people have the disease right across the country. And we should get those results very soon. We plan to continue to expand capacity. As I said, there's a new lab coming on stream next week that AstraZeneca and GSK have put together in Cambridge, and we'll keep going from there. But the other really important question is making sure we use this capacity in the best way possible. For instance, to have a real focus on care homes to make sure that we can tackle the epidemic within care homes as well. John.
Yeah, thank you, Secretary of State. Yes, so it is an extraordinary achievement to build this capacity so quickly. There is an element of consolidation required now. We need to move to a more sustainable footing, and we also need to try and integrate the work of the new laboratories with the existing infrastructure. So, for example, making sure that the results flow back to general practitioners and so on. So all of that is happening, and that will really help us to use this new capacity to its maximum benefit. And then, as Secretary of State said, there are a whole range of other opportunities to support the NHS, the care sector, and also other sectors such as criminal justice by making testing available. And I think the really exciting development is this rollout of testing at home, which of course will be very, very helpful for any contact tracing, a really flexible, fast way of getting tests to people when we're using our contact tracing, track and trace app and so on. So we're very pleased with what we've done so far, but it really is only a start, and we do need to apply what we have now to the challenges of the future.
Thank you very much. Yeah, have you got a follow-up, Hugh? Is that?
Just one more.
Yeah.
Can you ensure that health and care workers do get priority so
Yes.
they can get tested when they need to be?
Yes, absolutely. This is really important. Within the system that we've built, if health and care workers need a test, then they can get one as a priority, either through the NHS itself and the NHS's own labs, or through the employer route, so they can essentially go to the front of the queue in terms of getting an appointment to one of the drive-through centres, and that's an important part of making sure we have the right prioritisation. We've always talked about the prioritisation starting with patients and then people in the NHS, then wider key workers, and then the general public. And that prioritisation is built into the system. And just to build on this point of testing for contact tracing, the thing is, once we have contact tracing in large scale, then you want to be able to test people as soon as possible so that you know if there's a positive test, so that then the people they've been in close contact with can be advised to act accordingly and isolate so that they don't pass on the disease. So that is a very important other new part of the priority within testing once we get that up and running by the middle of the month. Thanks, Hugh. Sam Coates from Sky.
Matt Hancock, the 122,000 tests is a massive increase in a short period of time. How many of those are home testing kits that were mailed out yesterday but haven't actually been yet returned and analysed by labs? Because earlier in the week, number 10 was indicating that they wouldn't count against the target, but now it does seem as if they do. To John Newton, perhaps this morning we got the news that we've been waiting for, that you cannot get coronavirus a second time. That seems to have come out of a study from the South Korea Central Clinical Committee for Emerging Disease Control. How much weight do you put on that seemingly important study? And Steve Powers, I was interested that you were seeming to be quibbling with a colleague at Public Health England, Dr. Okereke, who was saying yesterday that children don't seem to be able to transmit the disease. Was she wrong?
Right. Well, what a feast of questions. I'll hand over to John to answer the precise numerical questions. We set out on gov.uk exactly how we count the different types of tests for different reasons, because obviously, exactly as you said in the question, home tests are produced in a different way to the tests at drive-through centres. So John can take us through the exact breakdown of the 122,347 tests yesterday. I'd just add that in total, we now, over the entire testing programme since the test was invented, have done over 1 million tests now, 1,023,824. So that's another benchmark that we've managed to reach. John, and then I'll ask Steve to answer the question about the transmissibility of the disease amongst children.
Yeah, thank you, Secretary of State. So the NHS, Public Health England laboratories, including laboratories in other countries, all 4 countries of the UK, undertook 39,753 tests between them, of which there were 2,537 in Scotland, 1,090 in Wales, and 1,319 in Northern Ireland. And it's worth mentioning we have a partnership with Roche, and that partnership, they undertook 13,723 tests. So the benefit of the public-private partnerships. The tests undertaken by the new Lighthouse laboratories total 79,522. Now, of those, 39,153 were undertaken in the drive-through centres or by mobile units, or in fact by research nurses who administered tests as part of the Office for National Statistics survey. Your question, the home kits delivered, there were 27,497 kits delivered, and there were 12,872 tests delivered through the satellite process. And then under the surveillance testing, which is the antibody testing, there were 3,072 tests undertaken. And so that's the breakdown of the total 122. So your question was about home kits, 27,000, and then there were 12,000 more that were sent out as satellites.
Thanks very much. Steve.
Thanks, Sam. So on the question of transmission in children, I'll say what I think the position is. John, with his public health expertise, will correct me if I get any of this this wrong. I think if a child or a young person is symptomatic, then there's no reason to think that they wouldn't transmit the virus in the way that any other person who's symptomatic would be. I think the big question is how many children don't have symptoms but get the virus, and in that particular case, or in those cases, how transmissible is the virus between them. And I think that is data that we are still accumulating and evidence that we are still learning about. And of course, it is one of the key questions when it comes to schools and how schools are opened again. So I think the true answer is that the evidence is still emerging over the transmittability of virus in children that don't show symptoms. But John, is that your understanding?
Yes, absolutely. And shall I pick up the question on immunity? Can you get the infection twice? So you mentioned that a study. The science on immunity is still emerging, and I think the general rule is that you would never make a decision based on a single study. So we would very much want to see that result replicated in other studies before we decided that was really the case. But it's obviously promising. I think people have said before in these briefings it would be very surprising if there was no immunity after an infection. But at the moment, I think the science is still not precise about how much immunity you get and how long it lasts. But nevertheless, results such as the one you mentioned are encouraging.
Thanks very much, Sam. Victoria MacDonald from Channel 4.
Thank you, Secretary of State. Can I just say that I'm not quite sure that Sam's question was answered. There is a report in the HSJ that previously a test would be counted only once the sample had been processed, but that testing has now changed and that it's being counted once it's been posted out. Is that the case? And then, Secretary of State, I wanted to ask you specifically, the ONS figures today show that you are twice as likely to die from COVID-19 if you live in a deprived part of the country. What is your reaction to that, and what policy implications does that have for you?
Yes, I'll ask John to answer the point from the HSJ, but it's not something I recognise. The point on the deprivation and the point that in more deprived parts of the country there appears to be greater impact. This is something that we are worried about and looking at, and we're looking at it in the context of all of the different ways in which this disease seems to have a different impact on different groups. So right from the start, we've known that it has a much more serious impact on older people. It appears to have a bigger impact on men. It appears to have a bigger impact on people from black and minority ethnic backgrounds. It appears that people who are obese are more seriously affected by the disease. And there's also this new evidence from the Office for National Statistics of the correlation with deprivation. So we are looking at all of these things and trying to understand the impact of the virus as much as we possibly can as and when we get new evidence. John?
Yeah, so there's been no change to the way tests are counted. As we've developed new ways of delivering tests, we've taken advice from officials as to how they should be counted. So the tests that are within the control of the programme, which is the great majority, are counted when the tests are undertaken in our laboratories. But for any test which goes outside the control of the programme, they're counted when they leave the programme. So that's the tests that are mailed out to people at home and the tests that go out in the satellite. So that's the way they are counted, have always been counted, and the way we were advised to count them by officials.
That's all set out on gov.uk. Sam Lister from The Express.
Thank you, Health Secretary. Concerns have been raised about how the over 70s have been treated as one blanket group during this crisis, including by senior figures in your party. Can you reassure over 70s who are fit and healthy that they will be treated exactly the same as the rest of the population when lockdown measures are eased? And also, it's been made clear today that this is not over, but now we are past the peak. People will obviously rightly be hopeful that they can start making plans to see family and friends again, perhaps even have a holiday. or meet up together and have a holiday together. Is late summer a realistic timescale for this?
Well, Sam, the last question is very tempting to speculate at, but unfortunately we just don't know. It's still too early to say, and I'm really sorry to have to give that answer, but it is. The 5 tests we've set out are there partly to try to give everybody a sense of when we'll be able to make those next decisions that I know people are yearning for. But we will only lift the lockdown measures when it's safe to do so. This is why test, track and trace is so important, because it will help us to do that. It isn't necessary to have that in place, but it helps enormously. But it is, as of today, too soon, and hence the message remains to stay at home because that protects the NHS and saves lives. And on your first point about the over 70s, maybe Steve, I can ask you to ask this, but we were always clear from the start. There's a very specific group who we've been in contact with, who we're asking to shield, which is ensure that they have as little contact as possible with other people for their own health reasons. And after that, the question is a degree, a gradation of the advice. Steve.
Yes, so of course we know, as you know, that that the over 70s can be absolutely fit and healthy, and that it's not the case that everybody over 70 has a chronic health condition or an underlying disease. As the Secretary of State said, we very specifically asked a group of individuals, some of whom are in that age bracket, but not everybody, to shield and to do everything they could to stay at home, because we knew that their underlying conditions put them more at risk of serious complications from COVID-19. So that's the group that is being shielded. Of course, everybody is complying with social distancing measures at the moment and being asked to stay at home, whatever age you are. So in the generality at the moment, everybody is in that same boat of complying with those measures. I think as we look forward, and as I said at the very start, the government moves to another combination of measures, including track and trace, that will help us keep the infection under control going forward. I think it's a perfectly reasonable question to say how would that work in sort of age groups and age bands, and although we do know that complications and unfortunately deaths are more common in the elderly, even without complications, I think that's for consideration, and that's work I think that we will need to do as we move forward. But I think your point is very well made.
Thanks very much, Sam. Alan Preston from the Belfast Telegraph.
Good afternoon. I just have 2 quick questions for the Health Secretary. In Northern Ireland, the impact of coronavirus has not been quite as severe compared to the rest of the UK due to factors like a lower population density. Do you think there's any merit in eventually easing restrictions here at a different pace to other parts of the UK? And my second question, as this virus does not respect borders, do you think it would be better for Stormont to work on an all-Ireland basis in fighting the pandemic rather than following the UK lead?
Well, thank you. The thing is that across the UK, the level, you're right, that the level of the virus has been different in different parts of the country. I mean, we saw that in the chart earlier that in London the level's been much higher, in other parts of the country lower. But what's interesting is that the shape of the curve, the rise and then the fall in the virus that's just started, has been basically the same throughout the country. And so that means that moving together, I think, was the right approach at the start. And I can see the case that could be made. And of course, the decisions that are devolved, we respect the devolution settlement. But ultimately, if you look at the shape of the curve, getting R down and getting the level of new cases right down, that's happened the UK together. Of course, the relationship with the Republic is important as well. And we have And we have good relations in terms of both at political level, but also at medical level in conversations with the Republic, with the decisions that they take. But we have very intensive discussions within the UK about the timing of changes within the country. Thanks very much. Steve Ford from the Nursing Times.
Good afternoon. A Nursing Times survey has indicated almost all nursing staff are feeling more stressed and anxious than usual, and a third described the state of their mental health as bad during the COVID-19 crisis, for reasons including PPE shortages. So my question is, what are you going to do in the long term to protect the mental health of nurses and other staff on top of the helplines that have already been announced, as we already have a well-documented nurse shortage, and I hope you'd agree that we can't afford to lose any more in the coming months? And secondly, what's your message for black and minority ethnic staff who feel they may have been put at greater risk given the emerging evidence from the mortality data?
Thank you very much, Steve. I think that the way that nurses across the NHS have risen to this challenge has been admirable. The bravery and the flexibility that nurses have shown right across the NHS. I think that's something that the whole country recognises it, and I recognise it as Health Secretary. I think that certainly the measures that we have put in place to help people with the stress and more serious mental ill health as a result of work, those measures are important, and I'm very glad that they're in place. I've been trying to get them in place for some time, and we managed to put them in place very quickly as the crisis began. But the other thing, it's undoubtedly true when you talk to nurses on the front line, that increasing the number of nurses so that there are more to do the work that's needed is a really important part of the plan. And as you know, we committed in the election to 50,000 more nurses by the end of the Parliament. We remain committed to that. In fact, we've seen more nurses come into the NHS over the autumn, and then also as a result, direct result of the appeal for nurses who'd left the profession to come back. So we have got more nurses back into the NHS, and I want to support and cherish every single nurse who works in the NHS because of the important work that they do. And so I'm sure that'll be a big conversation as we restore the NHS, and thank everybody for the work that they've done during the difficulties of coronavirus. Steve, I don't know if you want to add anything.
No, I think your point again is a very good point. And of course, it's not just nurses, as you pointed out yourself. It's all staff. There's been a tremendous effort by staff across the NHS. They have been working incredibly hard, sometimes in different areas from where they usually work, and of course that brings its own stresses. And I know, talking to the chief execs and the medical directors, chief executives and medical directors of many of our hospital trusts across the country, that as we begin to now stand up some of the services that we have had to stand down to manage this surge in coronavirus patients, those leaders locally are thinking very hard about how they support staff, because they absolutely recognise that they have gone through a very challenging and at times very stressful number of weeks, and that support is required both in the short term and over a longer period of time to ensure, as we move back towards a normal, won't be completely back to normal while we still have COVID, but back towards normal, that staff have the support they need. So I think the comments you've made are very much reflected in the comments I hear from our leaders across the health system.
Maybe you could answer Steve's second question as well.
The second question, just remind me, the second question was, Steve? Black and minority.
Right, yes. What's your message for black and minority ethnic staff?
And John might want to answer some of this as well. So I think the message for black and minority staff is that we absolutely recognise, as Secretary of State said earlier, that this virus is disproportionately affecting staff, and I absolutely know the concern and the worry amongst our colleagues in those groups. And in fact, I've been talking to them over the last few weeks, as I'm sure Secretary of State and others have. So there are things that we can do in terms of supporting staff and helping them through the concerns that they have. I think there's another piece of work that John will be able to talk about, which is to understand why it is, and again, Secretary of State touched on this a little bit earlier, why it is that the virus seems to be disproportionately affecting members of staff and the population as a whole from particular ethnic groups. So that work is ongoing in Public Health England, and I think maybe John will be able to say a little bit, because of course that will also inform what we need to do and the approach we need to take going forward. John?
Thank you. Yes, so as we know, the statistics do show increased rates in some people with some ethnic backgrounds. The effects are relatively small, and they do need to be looked at, although very important. But we do need to also look at some of the other aspects of the virus. So, for example, the virus is present in different rates in different parts of the country, and we know that that different parts of the country have very different groups of people from different backgrounds. So we need to look at all of these figures together to try and understand what's really going on. And so there is cause for concern, definitely, and we are talking to NHS England about any advice that should be given based on the data. But there is also an important bit of statistical work to be done to try and understand what the real underlying risks are. And I think it's sometimes it can be wrong to take these statistics at face value. We also know that unfortunately some different ethnic groups have different levels of underlying health conditions. So, for example, people from an Asian background do have more diabetes, and so we're trying to look at to what extent those factors might be at play as well. But it's a very important issue. One that a number of people are looking at, Public Health England, but also a number of university groups are also studying this. And we're feeding the results back to NHS England so that staff can get the right advice, exactly as you say.
But I think it's important for us to emphasise that we don't need to wait for that data. That data and analysis is important, but we don't need to wait for that to provide additional support. And in fact, when Simon Stevens, Chief Executive of the NHS, wrote out to our healthcare organisations, to hospitals this week, he made a specific point of ensuring that local healthcare leaders do pay particular attention to supporting and do whatever they feel is necessary locally to support our BAME colleagues. And I know from even today talking to some of those local leaders that they are absolutely doing that and providing that support.
Thanks very much, Steve. Does that answer your questions?
Yes, thank you.
Thanks very much indeed, everybody. That concludes this daily coronavirus briefing. Thank you.